Okay, this is for HHS310, Week 1. It's a warm Texas May day, and the students are out on the front lawn playing frisbee and throwing the football and studying around the trees. This is a small Catholic high school in Texas, and around the flagpole is a small parking lot, and in that crowd is a young man who brought a gun to school. Yes, even 40 years ago they were doing stupid things. I was in study hall with the window open, so I heard the gunshot. I looked over to the parking lot. Everybody seemed all right. But about 50 yards away, Ted was laying on the ground. When they checked on him, the bullet had discharged and gone straight through his spinal column at C2, paralyzing him instantly. It did not, however, kill him. And I visited him a few weeks later in the long-term skilled care nursing facility that he was in. He was unable to speak. He could only talk to us by blinking his eyes. He had a trach tube in his neck so that the breathing machine could do its business. He had IVs, a big white bed high off the ground with lots of pillows, and his mom sitting in the corner with a stack of books that she read to him every day. Around him, in and out, were nurses and doctors and technicians and housekeepers, and the social worker was there that day. And I remember being a senior in high school, what a tragic story for a 14-year-old boy to be trapped in a bed for the rest of his life. I went to see Ted in my early 20s, and he was still in the same high white hospital bed with all the handrails up and lots of pillows. His muscles had atrophied despite physical therapy. His mom still had a giant stack of books in the corner, and he still could only communicate by blinking. And he was still in a long-term care skilled nursing facility. He died at age 42, mercifully probably. On the other hand, his mother and his father and his two brothers did get to see him for many years. This is one story of a non-elderly person in need of long-term care, long-term skilled nursing care, because of a traumatic, catastrophic injury. Another story that I remember as clear as day is Jane, and I found Jane through a friend of mine who was taking art classes, and we got to talking about some portraits we were looking at, and they were done by Joan, and he offered to introduce me to Joan, and we went to what I thought was going to be a studio, but it was actually a private home, and she was 10 years my senior. Came in, it was just a normal 1930s built house in Texas, and in one bedroom Joan was painting in her iron lung. When she was 3 years old in the 50s, she had had polio, which left her totally paralyzed and required an iron lung to maintain her life. She spent 22 of 24 hours every day in that iron lung. The other 2 hours she had a marvelous recliner that had everything set up around her, and her mom and dad set up easels around her every day, no matter where she was, the chair or the iron lung, and she painted with her mouth beautiful portraits. She would have a small picture of whoever she was doing attached to this canvas, and pretty soon there would be a huge, beautiful portrait that she did with her teeth, so her teeth were all crooked and out of place because the brushes pushed them around. She stayed in that iron lung in her own home for another 5 years until her mother died. Her dad couldn't cope with it anymore, so Joan went to a skilled nursing care facility in her iron lung, and I visited her there once. She still had her chair and her painting, and she passed away about 6 years later. So Another example of someone needing skilled nursing care in a long-term care facility that was not 60 years old or 70 years old or had Alzheimer's. My last example of the different populations that we serve is about Baby Doe. I met Baby Doe when she was 2 days old. She had been born without a brain, anencephalia. The only thing she had was a brainstem, and the brainstem runs our heartbeat and our breathing, but it won't run it for very long because there's nothing to guide it. So it was inevitable that Baby Doe would die, and she was, by proper terminology, a terminally ill person, and was in a skilled nursing facility called an inpatient hospice. Now, as with all hospice patients, we generally do not do anything that will prolong life. No special treatments, no extraordinary life-saving activities, because it would be futile to do these things, and the patients generally don't want to be picked on at the end of their life. It's called dying with dignity. Well, in the case of a 2-day-old whose brain is absent, she can't see, hear, speak. She can feel, however. The inclination, of course, is to hold her often. She's a tiny, cute, wonderful-looking baby. She doesn't look like anything's wrong with her. But every time we touched her, it would activate her brainstem, and she would breathe a little faster, and her little heart would go faster, and she would live longer because we touched her. So it was very hard. There were signs all over the place, "Do not touch Baby Doe." We were not allowed to name her. Her parents, who lived in a small Texas town about 3 hours away, had named her, but we weren't told the name. We learned it at the funeral. Baby Doe looked like she had died at age 27 days. There was no breathing. She was dusky blue. Didn't appear to be having a heartbeat. Her fingernails were blue. There was no motion whatsoever. And we went in as a team, and I placed the stethoscope, a very warm stethoscope, on her chest to see if there was heartbeat. And there wasn't, but then there was. That tiny touch had revived her brainstem, and she lived for another month and a half or so. She died at day 74, and she was in a skilled nursing care facility long term. So when you start picking out your population to build your virtual skilled nursing facility, consider that this is not just a paperwork activity or something that you're going to be doing to gain 3 hours of credit at Bellevue University. This is a function of people, of real people, of Ted and Joan and Baby Doe, and all the elderly who have Alzheimer's, and everybody in between who can have catastrophic injuries or illnesses that require them to have skilled nursing care. These are real people who need real care, who pee and poop and throw up and need to have their throat suctioned out or be kept safe, to be loved, to be treated with dignity. So when you build your population, think about what population you want to take care of. And whether you're going to be an administrator, a nurse, a technician, a housekeeper, a vendor to these places in the future, in your future, it's important for you to remember that these are people in this virtual nursing facility that you're going to build. And that someday I'm going to be there, and you're going to be there, and you're going to expect good things to be happening to you or to your family member or to your child. So think carefully when you pick out your population. Research your population. Think about the people that you're going to be serving. Even though this is a virtual exercise, a paper exercise, it's important for you to internalize this as a learning tool. And one thing I will give you as a small task as you're building your population is that if you have a story about a child, a person, an elder who needed care in a long-term skilled nursing care facility, that you share that as one of the reasons why you might be picking out this population, or maybe why you're not picking that population. So please share with us your story as I have shared mine.